So let's look at myocarditis. This is a muscle part of it that is infected. So if I say that if you know the layers of the heart, then when it comes on to the infection of that layer, you will know that also. So if you have, if this is a myocardium, if it's infected, it's called myocarditis. So what it's going to affect? It's going to affect the contraction. So the definition is an inflammatory condition of the myocardium caused by viral infection, bacterial infection, and also fungal infection. So the myocarditis, serum sickness can cause it, rheumatic fever, and watch out because rheumatic fever you're going to see cause a lot of other heart disease. Chemical agent and even systemic lupus too is one factor that causes myocarditis. So the etiology is usually an acute virus, but it's self-limited, but it may lead to acute or chronic heart failure. So it may be acute or chronic at any age and not only in the elderly. So finding of myocarditis, because remember we said that it can cause chest pain. Okay, so depending on the type of infection, the degree of the myocardium damage, also the capacity of the myocardium to recover. So depending on the type of the infection, we says, and the degree of the myocardium damage, capacity of the myocardium to recover, and the host of resistance. So maybe minor or unnoticed when they're having myocarditis. So they would have fatigue, dyspnea, palpitation. They'll have occasionally pericardial discomfort, which is manifested in mild chest pain. So the history of recent upper respiratory infection with viral pharyngitis or tonsillitis, these are one of the precursors that they see that actually cause myocarditis. So sometimes they'll say, okay, tell me, have you had any flu or symptoms in a couple of weeks, how many weeks ago or so forth, and they see that, especially with rheumatic fever, which is one of the biggest causes when it comes on to myocarditis. So they will have fatigue and dyspnea, possible signs of congestive heart failure, peripheral edema, weight gain, crackles in lungs. So when normal heart sound is S1 and S2. If you hear a S3, it is an indication of someone having congestive heart failure. Okay, so murmur, they'll hear murmur, S3, or gallop, or friction rub. So tachycardia, that's disproportionate to the degree of the fever. We'll be seeing swelling. The swelling and the pain, a joint pain, is associated with the rheumatic fever. If you see someone having rheumatic pain and swelling and joint pain with a heart problem, like myocarditis, that tells me that this is caused by rheumatic fever and not necessarily a viral or other microorganism. So my question to you that I'm going to throw to the class is, what are signs and symptoms of congestive heart failure? Because myocarditis can actually cause congestive heart failure. So what are signs and symptoms of congestive heart failure? It says it peripheral edema, weight gain, crackling in the lungs, but it differentiates. If they have left-sided or right-sided, what signs and symptoms would you see? It will start with the lungs first because fluid is going to back up in the lungs. They may have fatigue because not enough blood going out to the rest of the body. Cyanosis, yes. So they'll do a diagnostic test. They'll do EKG. They'll do sedimentation rate. Also, what they're looking at too is that they'll do cardiac enzyme. They'll do troponin. They'll do creatinine kinase. One of the things I want to tell you, and I want you to explain this to me, what's the difference between the troponin and the creatinine kinase? If someone is admitted with myocardial infarction and they spend 4 days in a hospital, day 4, they're going home. When they went home, 2 days afterwards, they start having chest pain. If they go back to the hospital, so that's 6 days from the first myocardial infarction, okay? If they should go back to the hospital 6 days after the first one, they cannot do a troponin again, or even if they do a troponin, will not be accurate because troponin actually stay elevated in the blood for like 2 weeks, some books say 3. So because it's only 6 days after the first, that first level is going to be elevated in their bloodstream. So because the CPK-MB lasts for 4 days, 4 days will pass, they'll see an increase. So that one will be the one that they use the most. So also you want to manage, give antibiotic if infectious cause, corticosteroids to decrease the inflammation. They will give pain, analgesic for pain, cardiovascular medication to treat the heart failure, ACE inhibitor, beta blocker. They give also vasodilator and even digoxin. So diuretic will be given to treat the fluid overload. So here's my question to you. What will be an issue if someone is receiving furosemide and digoxin? Yes, furosemide, which is Lasix, actually is a potassium wasting. Yes, it depletes potassium, so the potassium will be low. Not only that, with the potassium being low and they're on digoxin will cause digoxin toxicity. So here's my next question to you. What are signs and symptoms of dig toxicity? Nausea, vomiting, and a low vision. So another thing that I want to touch on is the ACE inhibitor. ACE inhibitor stands for angiotensin converting enzymes. So what that does is that there's something called angiotensin 2 at the end product. What angiotensin 2 does is that angiotensin causes the kidneys. Angiotensin 2 tell the kidneys with aldosterone, hold back sodium in the body. And when it hold back sodium, this is naturally. Angiotensin 2 is a compensation when our body is dehydrated. It's a way the body tells the body to hold back onto water. So it produces the end result, something called angiotensin 2. Angiotensin 2 stimulate aldosterone. Aldosterone tells the kidneys, hold on to sodium, and wherever sodium goes, water will follow behind it. So that's how the body increase by a compensatory matter way to increase water fluid in our body. Another way too that angiotensin works is angiotensin will actually cause the blood vessel to get smaller. When the blood vessel gets smaller, it actually increases blood pressure. So when someone gets angiotensin converting enzyme, it blocks that what angiotensin is doing. Whatever angiotensin 2 is doing, it blocks that mechanism. So what's going to happen? Blood vessel is not going to dilate. What's going to happen too is that sodium will not be held back. Sodium will be gone. Will be leaving the body. So what will occur, or what can occur, is actually hyperkalemia because of that. Okay? Okay, so another thing that they will do too is oxygen titrate to maintain saturation goal. What does that mean, oxygen titrate to maintain saturation goal? Titrate mean adjust as needed to meet the goal. So if the doctor say that the goal is for the O2 to reach 98, then they will increase the O2 until it reaches 98. Then maybe they'll turn it down, and if it dropped down, they'll turn it back up. Titrate is a fix until it reaches a goal that is set. So the nursing intervention, you want to monitor cardiovascular status, notify the provider, and provide appropriate emergency care if instability or worsening is evidence. You want to also look for a change in pulse and change in respiration, blood pressure, oxygen saturation, and even the heart rhythm if there's any changes when it comes on to that. So signs of fluid overload. And remember, as you can see, with pericarditis, the problem with that is cardiac tamponade and cardiac effusion. Now we're talking about myocarditis. The problem with this is mostly congestive heart failure. So you're going to see signs and symptoms of congestive heart failure. Here's my question to you. How much amount of weight gain should you tell the client that they need to notify the doctor? Okay, so I like to add. I like to use max when possible. Max is my favorite subject other than reading. So what I will do is, or what I've done to remember this is, if the client gain, come on, what's up? If the client gain 1 to 2 pounds in 3 days, they need to notify the doctor. 1 to 2 pounds in 3 days, you can see 1 plus 2 equal 3. I don't know. Or regular people And that's a regular because some people have a 5 days a week work schedule, some people don't. Okay, so some people have a 5-day week work week. So if they gain 5 pounds in 1 week, they should notify the doctor. So again, if they gain 1 to 2 pounds in 3 days or 5 pounds in 1 week, then they need to notify the doctor. Okay? So change in pulse, we talk about saturation, signs of fluid overload, increased difficulty when laying down. And so one of the things that tells you that they're getting worse is that they used to sleep on one pillow. Now they tell you that to sit in a recliner, or they have to, they can't sleep while laying down, or they used to sleep on one pillow, now they're sleeping on 2 pillows. That shows you that it's getting worse. Also, you're looking for peripheral edema, increased weight gain, crackles in the lungs, jugular vein distension, and even murmur that's getting worse. So you want to monitor for indication of cardiac output. Example like lightheadedness, activity intolerance, fatigue, and dyspnea and exertion are some of the things that follow. Please take a note that pericarditis, the problem, it has a lot of problem, but the major thing it did is you want to prevent pericardial effusion and cardiac tamponade. Myocarditis, we're talking about inflammation of the muscle of the heart. One of the things that can occur is congestive heart failure. So nursing intervention also, you want to do ABGs. So you want to teach a client and the family how to slowly increase activity level as tolerated. Monitor and record daily weight. Notify the provider for weight gain greater than 3 pounds, as I said, in 1 to 2 days, and or greater than 5 pounds in 1 week. So avoid pregnancy, alcohol, or any competitive sports until approved by the provider. So also you want to teach a client about anti-infective drug, stress the importance of taking drug also as ordered, and teach a client how to take their pulse because they're taking the digoxin at home. And remember that if the pulse rate is lower than 60, then they have to hold the digoxin. Another thing too is they need to watch out for digoxin toxicity. So you need to teach them what are signs of digoxin toxicity. And we spoke about it: nausea, vomiting, blur vision. Some places will say halo vision. Some questions say vision disturbance. Choose whichever one. And they will also have cardiac arrhythmias. So you want to teach a client to report if they have any kind of rapid beating heart.